Respiratory infections in rabbits are a serious concern for pet owners, farmers, and enthusiasts alike. These delicate creatures are known for their sensitive respiratory systems, making them particularly vulnerable to a range of infections. Whether you're caring for a single pet rabbit at home or managing a larger rabbitry for agricultural purposes, understanding respiratory infections is crucial for keeping your animals healthy and thriving. In this comprehensive guide, we'll explore everything you need to know about respiratory infections in rabbits, including the causes, symptoms, prevention strategies, and treatment options. By the end, you'll be equipped with actionable knowledge to safeguard your rabbits and ensure their well-being. Let's begin by understanding what respiratory infections in rabbits actually are. Respiratory infections refer to diseases that affect the respiratory tract, which includes the nose, throat, windpipe, and lungs. In rabbits, these infections can be caused by various pathogens, bacteria, viruses, and even fungi. The most common culprit is Pastorella multicida, a bacterium that can cause a wide spectrum of respiratory issues, from mild sneezing to severe pneumonia. Other bacteria like Bordetella bronchiseptica, Staphylococcus, and Pseudomonas can also be responsible. Viral respiratory infections in rabbits are less common, but viruses such as rabbit hemorrhagic disease virus can have respiratory manifestations. Fungal infections, though rare, may occur in immunocompromised animals. But what makes rabbits so susceptible to respiratory infections? It's largely due to their unique anatomy and physiology. Rabbits have long, narrow nasal passages and small lungs compared to their body size. Their respiratory system is highly efficient but also fragile. Any obstruction or infection can quickly lead to difficulty breathing. Moreover, rabbits are obligate nasal breathers, meaning they can only breathe through their noses, not their mouths. This trait makes even mild respiratory congestion a potentially life-threatening issue. Stress, poor ventilation, overcrowding, and poor hygiene can further exacerbate the risk. Recognizing the symptoms of respiratory infections early is vital for timely intervention. The first signs are often subtle and easily overlooked. Watch for frequent sneezing, runny nose, and watery eyes. You may notice clear or cloudy discharge from the nostrils or eyes, and some rabbits may develop crusty or matted fur around the face. As the infection progresses, symptoms become more severe. Listen for abnormal breathing sounds, wheezing, snuffling, or rattling. Rabbits may breathe rapidly or with increased effort, and their appetite might decrease. Lethargy, hunched posture, and reluctance to move are warning signs that the infection is taking its toll. In advanced cases, you'll see open-mouth breathing, cyanosis, or a bluish tint to the lips and nose, indicating oxygen deprivation. These are medical emergencies requiring immediate veterinary attention. Understanding the underlying causes of respiratory infections can help you tackle the problem at its roots. The primary cause, as mentioned earlier, is bacterial infection, most commonly Pastorella multicida. This bacterium is widespread among rabbits and can be carried asymptomatically, meaning a rabbit may harbor the bacteria without showing any signs of illness. Stressful conditions, changes in environment, or concurrent illnesses can trigger the onset of symptoms in previously healthy carriers. Other contributing factors include overcrowding, poor ventilation, accumulation of ammonia from urine, dusty bedding, and sudden changes in temperature or humidity. Rabbits with compromised immune systems, such as young kits, elderly rabbits, or those with underlying health issues, are particularly at risk. Prevention is always better than cure, especially when it comes to respiratory infections in rabbits. Start by ensuring optimal husbandry practices. Provide spacious, well-ventilated housing that allows for the free flow of fresh air. Avoid overcrowding and keep groups small to minimize stress and the spread of pathogens. Bedding should be dust-free and absorbent. Wood shavings, straw, or recycled paper are good choices. Regularly clean and disinfect cages, litter boxes, and feeding equipment to reduce bacterial load. Control humidity and temperature fluctuations, especially in indoor environments. Ammonia buildup from urine is a common irritant. Remove soiled bedding frequently to keep the air fresh. Quarantine is an essential tool for prevention. Whenever introducing a new rabbit to your existing group, isolate the newcomer for at least 2 weeks. This period allows you to monitor for any signs of illness and prevents the introduction of new pathogens. If any rabbit shows symptoms of respiratory infection, separate them immediately to reduce the risk of transmission. Good nutrition is another cornerstone of prevention. Provide a balanced diet rich in fiber, vitamins, and minerals to support a strong immune system. Fresh hay, leafy greens, and quality pellets should form the basis of their diet, along with clean, fresh water at all times. Let's discuss treatment options for respiratory infections in rabbits. If you suspect your rabbit has a respiratory infection, seek veterinary care as soon as possible. Rabbits are prey animals and instinctively hide signs of illness, so by the time symptoms are noticeable, the infection may be advanced. Your vet will perform a thorough physical examination and may recommend diagnostic tests, such as bacterial cultures, blood work, or X-rays, to identify the cause and severity of the infection. Antibiotics are the mainstay of treatment for bacterial infections. Common choices include enrofloxacin, doxycycline, or trimethoprim sulfamethoxazole. It's crucial to follow the prescribed dosage and duration, as stopping antibiotics early can lead to relapse or resistance. Supportive care is equally important. Ensure your rabbit stays warm and hydrated. Provide tempting foods to encourage eating, as rabbits that stop eating are at risk of gastrointestinal stasis, a potentially fatal condition. Nebulization therapy may be recommended to deliver medication directly to the lungs and help loosen mucus. Your vet might also prescribe anti-inflammatory drugs or pain relief to ease discomfort. In severe cases, hospitalization and oxygen therapy may be needed. Remember, not all respiratory infections can be cured. Chronic cases may require long-term management, and some rabbits may remain carriers of bacteria even after treatment. Regular checkups and vigilant monitoring are key to maintaining health. Minimizing stress, avoiding overcrowding, and maintaining impeccable hygiene will help reduce the risk of recurrent infections. In summary, respiratory infections in rabbits are a multifaceted challenge that require knowledge, vigilance, and proactive care. Understanding the causes, whether bacterial, viral, or environmental, allows you to address the root of the problem. Early recognition of symptoms can save lives, and preventive measures, such as good husbandry, quarantine, and nutrition, are your best defense. When infections do occur, timely veterinary intervention and comprehensive treatment can make all the difference. By prioritizing your rabbit's respiratory health, you're investing in their happiness and longevity. Whether you're a pet owner or an agricultural producer, these principles will help you create a safe, healthy environment where your rabbits can thrive. Thank you for joining us on this journey to better rabbit care. Stay informed, stay proactive, and give your rabbits the best chance at a long, healthy life. For more expert tips and guidance, keep following SMART-AGRI Hub, your trusted source for smart, sustainable animal care.